Exercise addiction. What is exercise addiction? What causes it? And how can it be managed? What is exercise addiction? Exercise addiction belongs to a group known as behavioral addictions. This is where a person gets addicted to the benefits and rewards of their own activity. Exercise addicts become obsessed with exercise and are unable to stop despite negative consequences. The characteristics are similar to those found in other addictions, for example, drugs, sex, and gambling. These characteristics include continuing to engage in the behavior even when it is causing harm, continuing the behavior despite wanting to stop, engaging in the behavior in secret, and even when it adversely impacts other areas of life, such as relationships, work, and other activities. Another major characteristic of exercise addiction and other addictions are withdrawal symptoms when one stops or is unable to continue the behavior. Exercise addiction affects around 3% of the population. However, among some groups, such as sports science students and marathon runners, the prevalence is much higher. Research shows that areas such as gyms and fitness clubs, up to 42% of members can be addicted to exercise. What causes exercise addiction? To find out what the cause of exercise addiction is, an important question that needs to be sought is whether exercise is a result from another illness, for example anorexia or bulimia, or if exercise is the primary addiction. Exercise addiction can also transform from a secondary addiction to a primary addiction. An example of this is an individual using exercise to relieve withdrawal symptoms from other addictions, but then becoming addicted to exercise itself. Other causes can arise from becoming obsessed with wanting the perfect body, having low self-esteem, and can also be purely getting addicted to the endorphin release that comes from exercise. Managing exercise addiction. Although an individual may feel trapped and unable to overcome exercise addiction, there is help and many people have recovered. Managing exercise addiction may include seeking professional help from a GP, self-help groups such as 12-step programs, therapy such as cognitive behavioral therapy, education on the topic of exercise, and medication. Take-home messages. Exercise is often a positive, healthy part of life. However, for those who get addicted to exercise, it can lead to serious health issues, even death. In order to recover and find a solution, one must find out if exercise addiction is a primary or secondary addiction. There are solutions, including professional help from GP, therapy, self-help groups, and educating oneself on the topic of healthy exercise and what exercise addiction is.